Hello and welcome to the Honest Providers Podcast. My name is Dalton Young with IOP Link and Protect Advocacy. And today I'm with Lara at Mindful Growth Therapy. And really quick, just going to go over a few questions and let her share her experiences as a provider to, what it means to have ethical care and what honest providers should look like and should not look like. So welcome, Lara.
Hi, Dalton. Thank you for having me. I appreciate you, and I'm excited to answer your questions.
Definitely. Yeah. Tell us a little bit about Mindful Growth Therapy. So what are you doing over there?
So mindful growth therapy is basically kind of like my baby. I kind of started it. I'm a marriage and family therapist here in Florida. And I just wanted a place because I had worked in profit, nonprofit, private practices, different organizations. And I kind of wanted to find a place that's very safe for people to come in and talk to and just be who themselves, right? Validating who they are, validating what they're saying, their story, right? Just make it very client-focused approach and just help people. A lot of people, I think a lot of times people are not validated, and it bugs me. That's one of my pet peeves. So I really make it like a mission of mine to listen to everybody and validate people, because everyone has something, right? There's a reason they're going through whatever they're going through.
Absolutely. Everybody's story is different, and having that empathy and that why is super important, because I use this line all the time, we're in the people business. So that finding that purpose in not only what you do, but what drives other people is super important. So with that said, what sort of inspired you to get on this journey? Was it what you were just talking about?
Yeah. So, growing up, I never dreamed about being a therapist. It wasn't something that I wanted to do. I never even thought of therapy in general. But going through life, going through my marriage, and then going through my divorce, I felt like I had so much anger, so much hurt, betrayal, and I didn't feel validated. I felt lost. So I did end up going to therapy, and that kind of like changed my life. At that time, I had to have a degree in psychology and bachelor's degree, and I didn't know what I wanted to do with it. Right. So during that, I was like, oh, okay, let me get my master's. Right. And I chose marriage and family therapy because I really wanted to help people in relationships. I wanted to help couples understand what it means to be in a relationship, right? People get it in a relationship not understanding what it actually means being a relationship. Their idea is like, oh, I'm going to change him, or she's going to change, I'm going to change her. But that's not really what a relationship is. And then they just end up getting lost, and they lose a sense of who they are, and things shift. So that, plus a lot of the trauma that I've experienced, and I had to work through. So I did become a certified clinical trauma professional in order to be able to incorporate that into mindful growth practice. And then grief is a big thing. When my dad passed away, I don't think I dealt with grief the way I needed to. I kind of bottled it in, and I needed to be able to grieve him. So I think just after my divorce and this, going through therapy, it taught me all of that. So that was what, I need to do that as well, because I love helping people, and maybe that's my purpose in life.
Absolutely. Yeah. Crisis and trauma are, they're situations that are kind of life defining, and they will change your whole course in life. Like I said, you didn't expect to end up here, but here you are, right?
Yeah.
And Protect Advocacy. That's what Protect stands for with Protect Advocacy, is protecting rights of those experiencing crisis or trauma. And that's really just, again, that same sort of, so we have a lot in common there. And I appreciate you sharing those experiences about not only your story, but the emotions you felt and how you managed those emotions. And you're speaking from firsthand experience. You went to find therapy first, and then you had a full circle moment now where you're a therapist. So That's great, because it gives you know what it's like to sit on both sides. And that means a lot, because you can have that empathy for those that are sitting across from you. So you talked about some of the things that you did experience. Of those things, what made you want to do things differently than your own personal experiences? Like, there's always a way we can do things. I don't know if the word's better, but differently, right?
Yeah. I think, like you said, working in the field, first of all, I've worked with a lot of individuals who didn't have empathy. And that for me was kind of like, well, you're supposed to be a therapist or you're supposed to be a psychologist. How are you in this field if you don't have empathy, right, for other people? So that was one thing. Like, I wanted to make sure that I don't lose my humanity. I don't lose my empathy. So that's kind of one thing that I really made it a goal of mine to do different, is just to stay human, with everything going on in the world, see all of that, like just continue to have that empathy in me. Another thing is that I think a lot of times people are prejudged as clients or patients to go see a therapist, right? And I felt that sometimes I felt like I was prejudged, right? Because you kind of look a certain way or talk a certain way, or think it's like they know your story, but no, you really don't, right? Because we all have our own individual story, and I can't go tell somebody, yeah, you're wrong, this is how you should do things, right? Because I'm not an expert in their life. They are. So those, I think, were the two things that I really wanted to make sure as a therapist, to have people to express themselves and to be who they are, and then to also keep my empathy as well.
Definitely. Yeah, that was going to be my next question, is going to be basically what makes your approach unique, and you sort of answered that question as well, is that it makes, that empathy, and you want to make sure that they don't feel like they are a number. You want to make sure that they feel heard, and that, that they're not just another case of whether it's a failed marriage or whatever it is, right? That because everybody's situation is unique, and everybody responds to different emotion, responds differently emotionally. And you being willing to, again, empathy is a key word here, but you're showing how you really help people in a long-term lasting way. And I think that's super important when someone is willing to come to you. First of all, it's a big step to come to you in general. You've made that leap. You've watched your own clients or patients, however you refer to them, you watch them make that same leap to reach you. So it's a big step to even get help and then to show up. So I feel like the least you can do is be there and hear out their story and try to help them in a way that's not just cookie cutter, right? That's tailored to them, their experiences, and treat it like it's the first time you've ever heard about this, right? Because it may not be new to you, but it's new to them, right?
Absolutely, right? Everyone's experience is different, and I worked with people, and they're like, when a client or would come in, and they would say, oh, Laura was able to do this, you should be able to do it. And I'm like, no, you can't tell that, because people process things differently and people grow on their own pace, and you can't force change on people if they're not willing to change, and you can't force anything on them, right? You can't compare me to other people, and yet you can't compare other people to me. Everyone is different. And I think also a big one for me was, I'm Palestinian, right? So Palestinian American, Middle Eastern. We're not big on mental health. We're not big on, going to see a marriage counselor or a marriage therapist. So that in itself was also very big for me, to be able to take that leap, right? And to do something that's not typically normal. But I feel like we need that help. Like I wish people would take mental health much more seriously and say, okay, I need that help. I need to go see a therapist. Like I can't do this by myself anymore.
Definitely. And not only to step out of your comfort zone, right? But also when it's something that's ingrained, whether it's culturally or, depending on just where you're from in general, that can, being able to find someone that can relate to you on that level, right?
Yeah.
People that are experiencing those same sort of emotions, you have a unique blend that you bring to the table when you work with them, right? You may not be what some would call a stereotypical therapist or what you'd see on the billboards, right? You have a twist that you're able to bring to, express, your own culture and tie that into it, which makes it very powerful for not only select demographics, but all demographics, right? Because they're able to see a different side of the story as well because of your experiences. So, you talk about things you want to see different in the industry, things that could change, and how you do things differently. As a whole in the industry, we see a lot of clinicians that are burnt out. We see a lot of clinicians that are overwhelmed by the constant changes in legislature. And without going down the political road per se, what, in your opinion, needs to change in the industry in order for the industry to do better, to do better by our patients?
I think, first of all, even though mental health is so important and, everybody is struggling, right? Doesn't matter if you're rich or poor, where you're from, what background, what culture, what language you speak. Everyone has something, anxiety, depression, trauma, whatever it may be. And I think it's still not taken seriously. I know there are people that are out there that advocate for mental health, that advocate for, taking your mental health seriously, but it's still not taken seriously. And, even as therapists, we're often put on a pedestal that's a lot different than doctors or nurses are, right? And we're kind of like, we're expected to do more, but at the same time, we're not given, if you're talking about pay or if you're talking about everything, right? We're not giving those same rights. And then it's like, we're not supposed to be human. It's like, well, you're a therapist. You can't be human. You don't have your own life, your own emotions. Like, a lot of times therapists themselves are struggling, right? They're seeing clients, but at home, they're either going through a divorce or their kid is sick or something like that. But we're able to, still be present, still show up for our clients. But I think therapists are also not taught that you can't do that. Like if you don't need to reach a point of burnout. Like if you feel like you need a break, you have to, go get a break. And I think one thing that helped me with that was my supervisor, Dr. Hall, told me once, you're not a fixer. You're not going to fix people. Your job isn't to fix people. And I think that helped me so much in that aspect where, okay, I'm not going to burn myself out trying to fix people because that's not my job. My job is the opposite of that. I'm here to guide. I'm here to listen, to validate, to help people heal. Right? I'm not here to fix them and make them who I want them to be or, tell them how to fix themselves in a way.
No, that's great advice. You're not necessarily there to fix them. And there's, we talk a lot, or I talk a lot about when a lot of providers, they have to learn to take care of themselves in order to take care of other people. And there's a couple of ways to do that. First of all, who you surround yourself with matters. For example, your supervisor or other clinicians who you have, everybody uses you as a sounding board, but who do you have as a sounding board, right? Mm-hmm. Show up each and every day with a refreshed mind and treat each day one step at a time, because when you talk to all of these patients, you end up having to you're essentially you're carrying their burden as well as your burden. Not that that's a problem, but you have to learn to balance that, right?
Yeah.
Acknowledge your own emotions, because you have to be there emotionally for yourself, but also emotionally there for them, right? Because we are in fact also human. So, but I think that's great. I think that's great advice that they gave you. And, if as far as advice goes in the world, if you could share advice with any other therapist or any other person trying to get into maybe being a therapist, or families out there, about what would help them be able to identify or see what care looks like the right way.
Yeah. So I think for therapists, it's okay. One advice I would tell them is that it's okay. Like as therapists, don't forget you're human, and we are going to be meeting with patients, with clients that may trigger something in us, right? Like if someone was abused and, they're going typically not exactly the same, but somewhat, you may be triggered, right? Your emotions may be triggered because again, you're human, and that's okay. Like, to feel those triggers. Like it's okay for you to feel those emotions. Don't feel like you have to just, shut yourself down, right? I mean, there's a difference between breaking down in therapy with your, with your client, and between allowing yourself after that to take a breather to, to feel those emotions, right? Because that's where the empathy is going to come in, and that's how we're going to continue that. Don't take on more than you can handle. Like if your load is already full, don't feel like you have to say yes just because we're in this field to help people. And I know we want to help as much as we can, but it's also important to find that balance between helping yourself and helping people. Like you can't take on more than what you're able to, because then you're burning yourself out, and then you're not doing any good for your clients, because you're not going to be able to do a good job with them, and that's going to impact them negatively, because they're going to come and say, well, I had a bad experience with therapy and I don't want to ever do therapy again.
Right. And every therapist is different. Yeah. So
exactly. As for clients, I would probably tell families to listen to follow your guts, right? If you feel that something is not right, or if you don't feel comfortable with the therapist you're working with, or with the organization or anything, don't feel like you have to stay silent. You should advocate for yourself. There's nothing wrong in saying, I want another therapist, or I don't like how this treatment plan is going, or, I want to try something different, right? Because this organization isn't meeting your needs, and I always tell my clients, like, be transparent and honest. I would rather you go and get the help that you actually need than have you hate therapy and not, want to try it again.
Yeah, you want to, if you're with a therapist that isn't working for you, to obviously be able to be comfortable enough to let them know, but B, they may have a referral to someone who is better aligned with, maybe it's their situation, or someone that can connect with them, because it's all about emotions, right? It's all about learning to connect and be able to find comfort and peace, as well as learning to advocate for yourself that something isn't right. Again, something I'm very big on is advocacy as well. So I love that you mentioned that. So with all that said, so one little last question I like to add is, when looking back at your journey so far, and I'm sure it's been quite a journey, right? Because everybody's story is different. Looking back though at your journey, what are you most proud
of? Probably the fact that I was resilient and never gave up. And trust me, there were times where I almost, cried, like, I'm done, I'm done with this field. I'm done with everything. But somehow I always found the resilience in me to get up and continue. I'm proud of, where I am right now. I'm proud of the woman that I have become through all this journey. And I hope that my story, I hope that I'm able to reach other people and help them as well.
It sounds like you're definitely on the track to do that. And, based off everything you're sharing with me, and I really appreciate you taking the time out of your day to, jump on this call and
absolutely
be a part of our podcast, because you're sharing your story and you're helping change lives simply by sharing these insights on what honest care should look like.
Yeah. And I appreciate you also for having this podcast, because like we, mentioned, not a lot of people know that they can advocate for themselves, that they can, change providers, that they can speak up, and, they just end up either giving up or getting lost in a system.
Definitely. No, I can totally relate to that one. So with that said, Lara, where would be the best, if someone wanted to get in touch with you, what area do you primarily serve, and what would be the best way for them to connect with you?
So I am in Florida. So I do telehealth as well as in person. So I would say any place in Florida. I work with pretty much adolescents and adults. I do work with children. But mostly what I've been working with have been adults and teens. I love working with couples and families, trauma, anxiety, depression, empowerment, abuse, divorce, kind of, those are where I shine the most. And I work with individuals who have any type of chronic illness.
Okay. And where would they find mindful growth therapy on you have a website, social media?
Yeah, so I do have a website, and I'm also on Facebook and Instagram. So they can find me both there, and it's just Mindful Growth Therapy. They can also reach me by phone, call or text at 813-773-4981.
Okay, awesome. Well, again, Lara, thanks again for everything, taking time out of your day to speak with me and share these insights.
Sure.
And we're really excited to have you on here. So thanks again, and we'll talk to you soon.
Thank you so much.